I think everything Dr. O'Connell does is extraordinary.
Dr. O'Connell was just amazing and very kind and precise, but that she made sure I stayed and I did it and that I could get the results back.
And she was the best gift I could receive from this whole experience.
And I felt like I was part of her family, or like I was getting special treatment.
She's a light in the darkness.
The people that I remember most are most likely the younger patients, because that to me is usually lucky this person came in, lucky this person didn't just ask their friends, what should I do? People during pregnancy usually stick with me because there are so many changes to the breasts in pregnancy. And again, lucky they came in. So I think the message out of this is younger women who feel like, I can't get breast cancer, I'm too young. They need to know it's just, usually an ultrasound is all you need to make sure that you don't have breast cancer.
When I went in for my ultrasound, it was originally supposed to be a mammogram, but they told me they don't do mammograms on pregnant people, so we needed to do an ultrasound. Then the tech brought in the doctor, and they decided we needed to do a biopsy.
I went for my imaging. They told me right away it was cancer, that it had spread to the lymph nodes. And that whole diagnosis experience with COVID and just some different things that happened was very scary.
So when I found out that it was breast cancer and I was pregnant, my main concern was, of course, the baby, and I didn't know if he would be okay. So I felt really helpless with that, and also not knowing if maybe I should have known sooner. When I told my husband, he kind of had a feeling that that is what the issue was. He definitely had a hard time with it. His father passed away of cancer when he was young. Didn't want his kids to have that too.
And so when I came home, I had no idea what to do. I had no one to call, no one to turn to, so many questions. And I had met Dr. O'Connell through my work as a journalist, and I knew that she is the best of experts and a very compassionate person, so I thought I'll give her a call and see what she says. And she talked me through a lot of my questions. She helped connect me with the amazing team that I have now, and she reassured me that everything would be okay.
Dr. O'Connell, just knowing how vulnerable I was, and I didn't want to make emotional decisions. She was just always there, ask questions. She would give me direct answers. She would never sugarcoat it. She would tell me what was going on, but then the flip side of that, be really caring and comforting.
I nominated Dr. O'Connell for the Heart and Hands Award because I could think of no better person to win this award. She embodies compassion and care and expertise, and she is the perfect example of what I think every person in my position should have as their doctor.
As our nominators know, they see many care professionals during this journey. And what's really unique about the two nominations for Dr. O'Connell were that she was at the very beginning of their journey. And our nominators remembered her kindness, her compassion, her knowledge throughout their journey and nominated her today.
So it's not difficult being empathetic because it's everybody we know. It's every woman we know, or potentially, because 1 in 8 is a huge number, and every single one of us have family, friends, even selves, who've had cancer, so it's not difficult.
Congratulations, Dr. Avice O'Connell, on winning the Heart and Hands Award.